Assalamu alaikum. Today's article is titled Retrospective Analysis of Clinical Characteristics and Therapeutic Effect of Intentional Replantation. It was done by a Chinese group and published in Journal of Endodontics in 2026. This study conducted a large sample retrospective analysis to look into the clinical traits and prognostic factors of intentional replantation patients, thus informing clinical decision making. The study aimed to provide a comprehensive clinical profile of teeth selected for intentional replantation by analyzing the full cohort to understand preoperative conditions and intraoperative failure points and evaluating prognostic factors for success in successfully reimplanted teeth. The study included 445 patients, and the inclusion criteria were signed informed consent, complete preoperative CBCT and periapical radiographs, and detailed basic information and complete clinical data. And out of these 445 cases, 107 patients with postoperative follow-up of at least 1 year were selected for the study on factors affecting the therapeutic effect. So for the data collection, the collected indicators included demographic characteristics such as age and gender, characteristics of the affected tooth, treatment parameters, status and quality, and the preoperative CBCT imaging evaluation. And for the efficacy evaluation, 1 year or more after the procedure, the therapeutic effect was reassessed and classified as success treatment or treatment failure. Success treatment was defined as meeting the following conditions. The patient reported no subjective discomfort and exhibited normal masticatory function. A clinical examination revealed no discomfort, absence of sinus tract or mobility, and the radiographic examination indicated reduction or resolution of periapical lesions compared to preoperative findings, and no external root resorption present, and acceptable ankylosing of the tooth. And treatment failure was characterized by the patient experiencing subjective discomfort. Clinical examination revealed pain or discomfort or sinus tract or swelling and periodontal bucket, and the imaging showed that the size of periapical lesion remained unchanged or expanded compared to preoperative measurements. Now moving to the results and starting with the influence of preoperative factors on the success rate. Most patients were female and aged between 21 and 50 years, and the most commonly treated teeth were the mandibular second molars, followed by the maxillary second molars and maxillary lateral incisors. And the main preoperative symptoms were tenderness on percussion, followed by periodontal bucket, sinus tract, and tooth mobility. And before surgery, 93.71% of the affected teeth had undergone root canal treatment, and the success rate of teeth without periodontal buckets was significantly higher than that of teeth with periodontal bucket. The percentage was 83% versus 64%. The success rate of teeth without bony plate defects was significantly higher to that of teeth with bony plate defects, 85% versus 67%, and other preoperative factors had no statistically significant impact on the success rate. As for the intraoperative findings, the root surface cracks were identified in 66 teeth. Among second molar, C-shaped root canal configuration were present in 38%, and densum vaginatus was observed in 70% of anterior teeth. And other findings included external root resorption, isthmuses in posterior teeth, and perforations or lateral canals. And during surgery, 62 teeth were not reimplanted. The primary reason was vertical root fracture, representing 75% of the cases, and the intraoperative findings such as surgical materials, rinse solution, bone graft materials, concentrated growth factors, and postoperative splinting had no significant impact on the success rate. And finally, postoperatively, among the 107 teeth followed for at least 1 year, 84 teeth were successfully treated and 23 were failed. The overall success rate was 78.5%, and the success rate for second molars with severe coronal and radicular defects on the distal proximal surface was 73.68%, and the postoperative splinting did not significantly improve the success rate regardless of preoperative mobility grade, and no cases of ankylosis or external root resorption were observed during follow-up, and the key prognostic determinants were periodontal health status and integrity of the bony plate. So, to conclude their findings, intentional replantation showed favorable outcomes for complex bulb and periapical lesions. The main prognostic factors were periodontal health and bony plate integrity, while the timing of root canal treatment, whether preoperatively or intraoperatively, had no significant effect. And overall, intentional replantation is an effective tooth preserving treatment suitable for routine clinical practice.